Today on Beyond the Image, I'm sitting down with Nelson, technologist for SDMI, where we're going to talk about the difference between X-ray and CT and how to make the most out of the patient experience. Welcome, Nelson. Thank you for joining me.
Thanks for having me.
Absolutely. Let's start by giving our audience a little background on you. Tell me what made you decide to go into radiology and what brought you to SDMI?
That's a really long story. I don't know how much time you have, but I was actually a manager at a tire store here in town. And I decided late into my career after 10 years that I didn't want to bust tires when I was 50. So it was time to do something different while I was still young, while I could still do it. So I decided to go back to school. And my wife, she works in medical, and she decided, she's like, you know, you'd really be good in X-ray. And I was like, I don't know, but let's give it a shot. So I went to a school here in town, did a few rotations around town, and ended up working for a private office. So I didn't necessarily come to Steinberg right away, although I wish I would have. They treated me well and all, but the experience here at Steinberg has been pretty good so far. And so a few years ago, 3 years almost to the day, I started here with Steinberg, and rest is history.
So you're making a little bit of another change in career, moving from X-ray to CT. What led to that decision?
It was time, well overdue. Just time to advance, and you know, X-ray is great. I love X-ray. My favorite part of X-ray is I love taking care of patients, first and foremost, but training students and working with students that went to the same school that I did, working with them and watching them grow, that's one of the best parts of this, right? But it's time for me to focus on myself and my development and growth so I could expand my resume a little bit and have a little bit more knowledge under my belt.
Is that a natural transition for a lot of X-ray technologists to move out of X-ray and into another modality?
I think so. I think I'm the last one. I'm embarrassed to say, but I think I stayed a little bit longer than maybe some others do. Personal reasons, whatever it may be. But yeah, I think that the natural progression to go from X-ray into MR or CT or whatever other modality you'd like to go to, X-ray is definitely a great stepping stone for that.
Tell the audience what's the difference between X-ray and CT.
Well, you're still imaging, but from the images that I've seen so far, just the level of detail, it's just a different type of imaging, deeper scans and slices in the images where you can get a bit more information. You know, X-ray is great, and the different modalities combined help give a complete picture for the docs, right? But I think just viewing the body in a different way in CT is what's intriguing.
So I think most people know what a simple X-ray is, but what are the other things that happen in X-ray that patients may not be aware of?
So we have X-ray that we shoot, Dexa scans that we do, and fluoroscopy where we do other more invasive procedures than just standard X-ray film.
So what's an example of some of those procedures that you're doing in fluoroscopy?
Fluoroscopy, barium enemas, those. May I tell you a funny story about that?
I would love a funny story.
So when I got into X-ray, I didn't know what a barium enema was, let alone that I'd be helping perform it. So that was a bit of a shock. I was sitting in my seat in class and I'm like, oh, I don't know if I still want to do this. But there was no turning back. So, but it's, you know, it's an uncomfortable exam for patients, and it's important. You know, if something has come along the ways that the doctor has ordered it. So it's pretty neat to be able to be part of that and help the patient go through a very uncomfortable and difficult situation and help them be at ease.
How do you put patients at ease?
First and foremost, it's serious, right? What we do is serious. Most things that patients are going through are much harder than any of us will ever be able to understand, especially for them in the moment. But for me as a tech and me as me, it's a smile first. It's make them laugh first. It's make them comfortable first. Then we'll worry about the other stuff, because the other stuff's going to come regardless whether ready or not, right? But if you just put them at ease and help them feel comfortable first, it makes things a lot easier.
How do you teach that to students that come through?
Demonstration. So first and foremost, if you can't ask someone to do something that you're not going to do yourself, you can't be, oh, grumpy, grumpy, point your finger, and then expect somebody to act or be a certain way. So lead by example is first and foremost. You know, I show the students continually what I do and how I do it, how I interact. It's not, I can't force someone, you can't teach that, but hopefully if they see it, they see the interaction, they see how the patients appreciate it, they see how the patients reciprocate, it goes a long way, and you see them start to mimic in their own way, and they come out of their shell, and then they have their own interactions, they put their own taste, their own twist on it, right? And it just makes that experience better for them and the patient.
How do you see SDMI embodying the patient experience throughout the organization?
I see it everywhere. I see it in every department, you know, and I try and live up to it right in my own department. And I'll continue that when that transition to CT goes on. But I see it from every level, you know, it's patient first, and just try and deliver that, you know, easy and safe environment for our patients.
So we talked a little bit about the not so fun procedures in fluoro. What else is happening in fluoro that patients may not realize is kind of a portion of the X-ray department?
You know, that's actually funny, because when we get exams, especially in fluoro, most of them have no idea what they're in for. They don't know, you know, that there's the injections involved, that contrast is going to be administered, potential reactions, or even what the exam is. A lot of the swallowing studies we do, like barium swallows and esophagograms, upper GIs, things like that, the patient has no idea. The doctors, when they're given this order, they have no idea what to expect. So we explain the procedure, give them, you know, advanced explanation of what's going to happen before it happens to help put them at ease and make it a little bit easier, right? But yeah, they a lot of times, if it's their first time having a particular exam done, they just don't know what to expect. So that falls on us to help ease that situation.
What do you think has been SDMI's biggest impact on the community?
Only being with SDMI for 3 years, I'd have to say just the availability. We're, you know, pretty spread out throughout the town, so easily accessible. I think it's, I've only worked at a handful of the locations, training and whatnot, but I can see the continuity between offices to offices. So I think just making it easy for the patients to be scheduled, easy for the patient to interact with staff, easy for the patient to have the exams done, and the reporting. You know, our doctors that I've worked with personally are just, they're amazing, love them to death. But every aspect of it, they just make it easy for patients, and that leads to, when it's easy for the patient, it wants them to come back. They have options. Everyone has options, right? But if you make that inviting, easy, and safe environment for a patient, they're going to want to come back. And having the accessibility throughout the city, having staff that wants to actually take care of their patients, I think it speaks for itself.
Do you have a favorite patient? Or a most memorable patient?
A lot of them are great. Okay, I love working with patients. Otherwise, I wouldn't be doing this, right? But it's hard to pick just what's my favorite patient, what my favorite experiences, because there's been a lot of really funny situations that have happened, and just how people interact. It's funny when people are nervous, how we react, right?
Yeah.
You get it in the room. So how they react, things that they say, and how they react. Kids, surprisingly, when I came from a very small clinic, right? And I didn't really deal with children. So coming to SDMI, a whole different aspect that I didn't experience in my career is dealing with peds. I was so scared to deal with peds. Oh, am I gonna get everything right as a technique? How am I gonna do it? And peds actually are really fun, because they're so scared. They have no idea what they're in for. And you just turn up the lights and you just have fun with them for a minute. And it really changes the entire vibe for the peds, right? And hopefully I don't sound like Olaf on this video, but some of my coworkers say I remind them of Olaf. So I use that a lot to make peds, at ease. They'll be like, I'm scared. I'm like, well, do I remind you of Olaf? Have you watched Frozen? And it turns into a completely different conversation and experience. And to be on the safe side, I'll go with peds. Peds are my favorite.
Okay.
Which, ironically enough, were the patients that I was most nervous about coming.
What do you think is easier, peds patients or adult patients?
Peds patients.
Yeah.
Let me tell you why.
Okay, tell me why.
Because they tend to hold still a little bit better sometimes. It's completely different. Dealing with peds, the complete unknown, especially if it's their first imaging, you get to be part of that. And it's like, and they walk past the monitor, they can kind of see, I can't talk about anything, but look, there's your heart. You know what I mean? So, and just the look on their face when you take care of them, and then it's not as bad as they thought. I kind of like to do magic when I'm with them. Our particular room has an auto detent where you push a button and the equipment kind of moves into position, which is pretty rad, by the way. I have a student or I have somebody in the back controlling it, and we'll do magic as the tube moves overhead, just to kind of get the ped involved and get them kind of calm, and it actually works pretty well.
Walk me through what the patient is going to experience when they come in we'll just use a simple x-ray. What is that patient experience like?
We'll grab their paperwork, right, and bring it to the back, and then we'll analyze the paperwork. But when we address the patient, we'll greet the patient and, get them changed, get them prepared for the exam, and then we'll get them into the room. We'll set up the room first, right, and then get them into the room and just introduce ourselves, let them know that we're going to be taking some imaging or fluoro or whatever the case may be, and then just go over the history, obviously acknowledge the patient's name, date of birth, our point of verification, get their history, and then just kind of explain what we're going to do in the room, depending on what the exam is, and then go from there.
Are patients changing for their exams with you, or can they have an x-ray done in, can I come in what I'm wearing right now and get an x-ray, or are you going to make me change into a gown?
Depends. If I'm doing your hands, you're good to go. But if we're, if we want to get the best images possible, right? So in order to get the best images possible, we don't want any buttons or necklaces or bra or anything else, any clothes that might have any metal or plastic on it. So we'll get them changed before we get them in. We'll give them a couple gowns, and then explain how to put them on and whatnot, and just to provide the best images possible. Sometimes patients don't understand, hey, well, what do I got to take my clothes off for? It's just a chest x-ray. Well, the last thing we want to do is have any artifact on the clothes or on a bra or sports bra or buttons or anything that might either cover up something that might be in the lung field or make it look like it's something in the lung field. So we just want to get them changed properly so that they're ready just so we can provide the best image quality possible.
Let's talk about Dexa scan, because you kind of touched on that a little bit, but then we quickly moved over to fluoro. We flew right by. Tell me, what is Dexa scan?
When we do a Dexa scan, we're just checking the bones for osteoporosis, osteopenia, see how strong or brittle the bones are. There might be other factors that a doctor may order, but typically what we see is checking to see the health of the bone. As we age, as we get older, and maybe not take care of ourselves the way we should, our bones become more brittle. It's just a natural process. So we do our Dexa scan to see how it's developing. Is there medication that could be given or something? Obviously that's between your doctor, not us. But we could at least do that scan to provide that data for the doctors to see, hey, can we get a jump on a potential problem before it turns into something serious?
So 3 years in x-ray at SDMI, how many years in x-ray prior to?
It's 11 years total.
11 years total. Yeah. So in your 11 years, how have you seen technology change?
When I first started, it was on film, and it was just transitioning from film to digital. And that was weird, right? I was a student when it was film, and then the first site I went to as a student, it was on film. And you take one image and you're processing it, and hopefully you got it. If you didn't get it, well, let's go shoot it again. And the patient's sitting there waiting, and then as time went on, okay, now we have CR panels, right? Where it looks like a film cassette, kind of processes like a film cassette, but it's digital, so you can manipulate it easier, you could see it faster. Then from there, now we're on digital panels. Thank goodness we're on digital panels now. It does make it a lot faster for patients, which helps with the patient experience, but it requires less radiation to capture the image, so it's safer for patients also using the digital, so that's always nice. So.
How long does a simple x-ray take?
I think I can do a chest x-ray in 4 minutes from change to history to exam on, depending on the patient. I can probably get you done very quickly. The person sitting next to you might take a little bit longer. They might not move as fast. A little bit slower on giving history or getting history, maybe a lengthier history. Maybe their health condition just determines that, hey, I just can't do this as easy as someone else can. So it's very different. There isn't a blanket how long does it take, unfortunately, because everyone is different.
Sure. So if a patient comes in and they're waiting, it could be that the patient ahead of them was that patient that took a little bit of extra time.
Yeah, I think that's sometimes, unfortunately, we will get a little bit backed up. It looks like we have multiple people that are getting called back for the same thing, and it's not. So at least in our location, we have our fluoro room, we have X-ray, we have Dexa. So they're all three groups may be sitting out there waiting for imaging all at one time. So we call one over the other. It's not that we're skipping anyone. There's 3 different modalities that are happening, right? But it could, if somebody does take longer to do their imaging, it could back everyone else up. Unfortunately, it's unforeseen. We can't.
Are those some of the most common patient complaints that you get, the wait time or somebody's being called ahead of me or something like that? Or what are the common patient complaints that you?
I think that we do pretty well as far as times. Times isn't so much a complaint. And if that's the case, I'm sorry. But I think that I do get a lot, I was here before that person, and you get that I was here before that person a lot. And then, you just take a moment and just kind of explain what's going on, that we have multiple rooms. We try and get a jump on it though ahead of time. Hey, you'll be next, but I'm waiting for this particular room. We have somebody that we're gonna pull in. It's different modality, so we're not skipping you. So it's a level of communication also that helps put that at bay, right? So it doesn't get to the complaint, but no one's perfect. I'm not perfect. Nobody's perfect.
What are you most looking forward to about CT?
Diving into the imaging, right? Because it's completely different. Even though I've been doing this for 11 years, looking at an X-ray and looking at a CT is very different. So learning that aspect of it, learning how to see the images. Anatomy is anatomy, so you kind of know what the anatomy is, right? But seeing it from a different view is, I think, what's exciting. I've been doing X-ray for 11 years, and I'll still see an X-ray today. It's like, ooh, that looks weird, or that looks cool, or ooh, I've never seen that before. So I'm gonna miss that. After 11 years to still be able to see an image and, wow, that's pretty neat. That's fun, that's exciting. But this is a whole new chapter, right? And going into CT is really exciting because now I get to see it from a completely different view, see different types of exams, and just learn something new.
So we talked about fluoro and that you get to do some different types of procedures working over on the X-ray side of things. As you transition into CT, are you still going to have the experience of doing procedures in that new modality?
Oh, absolutely. I get to learn CT biopsies, which is great. I am excited about that. There's still the contrast studies. CTAs, as a friend once told me, is like arts and crafts when you're first learning it. So painting those up should be, and learning how to actually post-process that should be fun.
What do you think sets SDMI apart from other radiology practices?
I've never worked at another radiology practice. It was a private office. And fortunately, I've never had to have imaging done at another, or really many scans done. So firsthand, I don't personally know, but what I hear from patients is the people. You guys are way different, is what I hear all the time. Your facility is much cleaner, more organized. I hear that all the time. Just that we're just a great group to work with, and that's exciting for me to be part of that and help continue that with how I help and deal with patients.
What advice do you have for somebody who is considering healthcare as a career path?
Don't second guess it. Don't second guess it. And if I wish I would have known, not to sound ignorant about it, obviously I knew that there's medical, right? But I wish I would have known when I was younger what this path could do for me, right? And I wish I would have known about this career and just being in this side of medical when I was younger, and I would have jumped all over it. I'd tell patients all the time that, hey, what do I need to do? Do you think it's good to get into X-ray? Absolutely, it is great to get into imaging. I wish I would have known about it sooner, you know. And I really do. So if anyone out there is really thinking about getting into imaging specifically, absolutely, without a doubt, don't hesitate.
What do you think the future of imaging is?
Well, I'd love to see something you see on sci-fi movies, right? But you look at some of the imaging that we do now, and it's pretty cool, you know. Even you look at like some of the sites that do a scoliosis study where it's all stitched and it shows you the one image of your entire body like that. That's pretty cool. What's coming in the future? Handheld devices, holograms, I don't know, but I hope I'm around to see it.
If you could tell patients one thing, what do you want patients to know?
Don't be scared, because it's not as bad as you think it's going to be, especially in fluoro. Fluoro is terrifying to some patients for some reason, and maybe it's the unknown. And I tell patients all the time, after explaining the procedure and after talking to them about it, it's not going to be as bad as you think it is. You know, we're our own worst enemies. And I think when we get into a room and into that unknown, into an experience we don't know, I think our brain goes sideways a little bit, right? And rightly so. You know, I'm here because I'm here all day long. You're here because you have something wrong, right? But we're here to help, right? We're here to get answers or help get answers. And it's not going to be as bad as you think it.
All right, I have one final question for you. What would your younger self be most proud of you for or most surprised by?
That I actually went through with it. I am a creature of habit, and it's taken me 3 years to get into CT because I am a creature of habit. I need things a certain way. I need my little corner. Okay, this is my corner. This is what I'm used to. This is what I know. I'm going to excel. The unknown, like patients, scared of the unknown. That's me, right? So my younger self would be absolutely floored that I'm jumping into CT right now and going to take on an adventure when I'm so comfortable and I'm excelling in where I'm at now. To completely shatter that comfort zone and jump into something new, I think my younger self would be pretty proud.
Okay, and I know I said that was my one last question, but I actually have one more for you.
I'm kidding.
So if patients are watching this and they say, hey, that Nelson guy, he looks pretty nice, I would like him to be my technologist, how do they find Nelson?
That's a better question for June. Because as I transition, I'll be training at a particular location, and I don't know exactly which location I'll end up. Hopefully somewhere that'll welcome me. I'm sure they will. But there's a lot of really smiley, happy techs out there ready to take care of any patient that we get.
Awesome. Thank you so much for your time today, Nelson.
Thank you for having me.